So we are at Ankura Hospital, and which means the germination of new life, which also means germination of new seed, new plant. So giving life and giving happiness, and that's what Ankura is determined to do. So I have the founder himself, Dr. Krishna Prasad, very famously known as Dr. KP, and here I'm going to have a small chit chat with him. Thank you very much for being on our show, sir. So we welcome you today on this special eve of International Women's Day, sir. And thank you for your time, for being with us here today. What's the dream behind to come out with Ankura Hospital?
Thank you, AIBIZ News, and thanks US for giving me this opportunity. Ankura Hospital, as you know, it's an exclusive women and children's hospital, and we deal with problems and healthcare issues faced by women and children exclusively. Back in 2011, when I was back from Australia, there were very few mother and child hospitals which are exclusively meant for women and child healthcare. And we thought most of these patients with the health issues, particularly in women and child segment, they are not so comfortable going to a multi-specialty hospital and getting treated there because their needs are very different and their healthcare needs are different, and they need a kind of special space for them to be treated, and people should listen to them differently compared to all other population. So we thought we should come up with a center which exclusively deals with women and child health. So that's when we thought we should start exclusive women and child hospital, that's Ankura, and we started in KPHB in Hyderabad, and which was started as one branch, and now we are at 10 branches and 11th coming up in Vijayawada. So now we are spread across both AP and Telangana, and looking forward to move up the north.
So, Dr. KP, what's the vision and mission of Ankura Hospital?
Yeah, Ankura Hospital, as I said, it's a specialized hospital for women and children, and we put the quality of care as the utmost priority and utmost important thing in our deliverables. So we attain that quality of care by bringing in the right kind of expertise who have that experience in dealing with women and child care. And also by reaching out to the patients across the demographics. We don't want to limit ourselves to only to metros, and we want to reach out to the other parts of India by giving the same quality of care. People may get that kind of care in metros like Hyderabad, Bangalore or Chennai or Mumbai, but what about the other parts of India? So we are trying to bridge that gap by giving the same quality of care across.
So what are Ankura Hospital's complete range of medical services?
Medical services include both pediatrics, obstetrics, gynecology. So in that, pediatric surgery is also one very important thing which we are one of the best in. I would confidently say that we are one of the best in the world in terms of pediatric surgery and neonatal intensive care and pediatric intensive care. So the problem what we are facing as a country is in cutting down the infant mortality rate and also the perinatal mortality rate. That means the babies dying early. So we are helping our bit by giving the quality of care, so that to help in cutting down the infant mortality and perinatal mortality rate. And also the laparoscopic keyhole surgeries, what we call in both women and children, we are one of the best in the country. So we are providing across all our centers all these services which we are providing all across the centers.
Dr. KP, could you tell us more about your personal experience while in the process of building Ankura Hospitals into a prominent brand in concerning with the women and child health care segment within a very short span of time? What's the reason?
Yeah. So we started off as one center in Kukatpalli region. That was back in 2011. That was, I think, 9 years back. And now we are 10 centers, and now we have 800 beds. When we started, ours was only 80-bedded hospital, and we never thought of making it a chain hospital at that point of time. But we have started in 2011, and then we thought, we were seeing so many patients with the request saying that we don't have the similar kind of facility in the other part of Hyderabad. So we are getting those kind of requests from our own clients and our own patients. Then we thought maybe it's a good idea to expand to some other parts of Hyderabad and try giving the same quality of care. And I mean, the quality of care is very important, which we don't really want to compromise at any point of time, because sometimes when you are in the process of expansion, it may get diluted. But we made sure that that was not compromised at any point. We have spread across Hyderabad, and we became very successful in doing that, and our patients appreciated that. Then we have moved to Khammam, that is one of the district headquarters in Telangana, and where we were successfully able to give the same quality of care what we are providing in Hyderabad. Now we have one center in Tirupati and one more coming up in Vijayawada. So we had lots of challenges when it comes to opening and spreading and trying to give the same quality of care. So I had to thank my team who has put in a lot of efforts. My team, including doctors, paramedics, all administrative staff, and the branding team, everyone, marketing, everyone put in a lot of efforts to make this dream a reality. Now I can confidently say that we are able to deliver what we actually wanted to deliver, and that is across all the 10 centers we are able to do the same things.
Dr. KP, what are the standards does Ankura Hospitals follows for improving the quality of care for children and women, especially the young adolescents, in your health facilities?
Yeah. As I said before, the healthcare needs of women and children are very different from the rest of the population. So quality is one area where we have focused from day one. So that is, I would say that one of the main reasons for the success of Ankura. And we have a dedicated quality team which is placed across at the unit level and also at the corporate level, who monitor we don't even not only monitor the quality of care, and also we monitor the processes behind it, so that they don't get compromised. The care what patient is expecting should be experienced by them. So that is the motto what we always we always have, and we always try to meet the expectation of our patients. Also, we are NABH accredited hospital. Accreditation is one very important thing in terms of maintaining quality of care. Sometimes, in the process of expanding, you may forget few things which are very, very important. So these accreditations, they keep you on toes, and they help you in going back and see where we are missing and what we are missing, and making sure that everything is in place. So yes, and we take accreditations also very seriously, so that we have third-party inspections to look at our quality of care, and also we have our training program in terms of patient experience training program, and also we keep assessing our doctors very regularly, and we monitor their clinical work, and we take the feedback from patients. So all these put together, we make sure that our patients get what they deserve.
To execute all this, Dr. KP, does Ankura Hospital has a framework in place for improving the quality of pediatric care?
Framework, definitely yes. We do have a framework in place. As I said, we have a quality team which completely looks after the patient care, and also we have, as I said, feedback mechanism from the patients. So every year they the needs, and also the whatever the patient is requiring, they may keep changing. We have to keep evolving as we keep growing. So to keep up to the new challenges, we always audit ourselves, and also, as I said, third party audit also we keep doing, and also keep doing a lot of training exercises. So all these put together, and we are able to achieve what we are actually doing.
That's marvelous. In fact, Dr. KP, what kind of evidence-based practices for routine care of children and management of illness is followed in Ankura?
Yeah. Ankura, we always follow evidence-based medicine, and we have teaching program at Ankura. It's a DNB teaching program, and also we have fellowship program which are accredited to the National Neonatology Forum and also Indian Academy of Pediatrics. We have fellowship in neonatology, and we have fellowship in pediatric intensive care. We have DNB program, which is a national board program, deployment of national board exams, and we have so all these things, all these students coming in also keep stimulating the consultant, because they have to be on their toes and they have to follow what is the latest evidence. I mean, and also we keep the research as one very important thing, and we encourage our consultants, our students to participate in research act, and so that actually keeps us what we are doing. So that makes us to practice evidence-based medicine.
So, Dr. KP, any integrated management of neonatal and childhood illness?
Yeah. See, most of the times when a child comes to neonatal intensive care or a neonate is born, most of the times they are managed by a neonatologist. So sometimes, those babies may have the issues with low birth weight. Sometimes they may be born normal, and they may start having issues immediately after birth. So those kind of issues have to be dealt by a proper specialist, those are neonatologists, and they also need follow-up care. They may get discharged from hospital. These are the special kids I'm talking about. So they may need specialty treatment in follow-up care also. So we have follow-up outpatient clinics for these high-risk newborns. So they are taken care of even during the pediatric age group also, post-neonatal age group. That means neonatal age group, I would say that if it is till 30 days of life, and post that also they are taken care in the high-risk clinics. And some of the babies who are born normal, but they may develop developmental issues. Like nowadays you might be seeing so many kids with autism, ADHD, the hyperactive kids. Some babies, some kids may not really talk that well to the strangers, and psychological issues as well, psychosocial issues. So to deal with these kind of issues also, we have an exclusive child development center. Now we have one in Kukatpalli, Hyderabad, and one we have started in LB Nagar. Even there we have an exclusive child development center, and also in Tirupati. So what we do at child development center is basically we deal with these special kids. Like some kids may have speech issues, some kids may have behavioral issues, some kids may have other learning disabilities. So we deal with all these kinds of problems. They may not get these kind of integrated solution at many places, but at Ankura we are. I am proud to say that we are solving most of those issues.
Now, Dr. KP, any emotional and psychological support given to the women?
Definitely. During the childbirth or during pregnancy, they need a lot of support. Not only just from family. When they come to hospital, they expect that kind of support from the hospital also. So what happens is when they come to outpatient department, the patient care coordinators who meet them, they kind of become friend with them, and they go through the journey of what a patient is going through. They talk to them and they listen to their stories, what is happening at home, and how they have been. If the last visit was a couple of weeks back, they try to know what is happening in the last 2 weeks, and they kind of take this feedback to the consultant. Okay, and these are the issues. Not only the medical issues would be dealt by a consultant. They may not open up that well in front of consultant doctor when you ask about the social issues and all other issues. So, which is very important actually in treating a patient, because it gives that holistic care. So we involve the social workers and patient care coordinators very effectively to get to listen to our patients, and also in a way to give the right kind of treatment to them, and also right kind of suggestions to them. Yeah.
Now, Dr. KP, in Ankura Hospital, what is the health system in place, like quality of care, provision of care, experience of care?
Yeah. As I said, like patient experience is a very important thing, and which we are focusing on, and which we have taken it very seriously. For that, we at a hospital, when a patient comes, he not only meets a doctor, he meets so many people. He meets he or she, they first meet the front office reception guys, then the coordinators, then a nurse, then a doctor, then a pharmacist, and then a lab technicians, a lab in charge. They meet so many people, and they expect a similar kind of experience, and also very pleasant experience. Because they come with some or the other problem, and they expect a solution from a hospital rather than creating one more problem to them or adding up something to them. So we take this up very seriously, and we train all these people who are in directly contact with the patient, and also those people who are in the background also. They may not be in direct contact with the patient, but we train everyone in the soft skills, and also in dealing with the patient, and also how to how to react to situations. In terms of some people may come in a very emotional state. If a kid falls sick, or if a woman falls sick, which they might not have expected that they fall sick at that point of time. So sometimes they carry a lot of emotions. As a healthcare giver, we should absorb, and also we should balance, and we should support them in tough situations. So we train all our people in dealing with these kind of situations. And also quality of care, as I rightly said, which is very, very important for us, and we continuously monitor our team's performance in terms of outcomes, and we compare with the global standards. And also we have as I said, like quality team which continuously monitor, and also we have a third party quality monitoring also in place.
Dr. KP, what are the patient-centric care and support services does Ankura Hospital has in place?
As I said, patient-centric care is very, very important, and the new thing which is in place now. I mean, the patients are experiencing individualized care. When they come to hospital, they don't want to be treated like as a group of people getting treatment. They want this is my problem, and I want individualized and specialized care. So we are very much in line and aligned to that, and we are training our nurses and doctors in giving a specialized care, and wherever possible we are giving 1:1 nursing, so that a nurse dedicatedly work with that patient only, so that they attend to all the problems, and also availability of doctors. So whenever they have a problem, the minutest of the problem also, patient should be able to call doctor directly when they are in hospital. So that kind of service which we are providing, so that they should not have any doubt or any stress when they are in Ankura Hospital. So we make sure that they are comfortable when they are with us by providing all these services. And also telemedicine is one thing which we are aggressively pushing. Most of the the COVID era, during this pandemic, many people are locked at different places. I mean, they're working from home, and they may be somewhere in the north, or somewhere in Bangalore, or somewhere in different parts of India. So they may have issues which they want to talk to their doctor only, which was not really possible before COVID pandemic. So post that, we have come up with a very good telemedicine solution where they can actually talk to their doctor and have a video call and a video consultation and get the prescription and have a chat, and sometimes they may not really need any medication, they may just need that kind of support and assurance from the team. So we are reaching to our patients by all these means.
Dr. KP, what is Ankura Hospital's commitment for lowering cost, enhancing quality of health services for especially women and child?
Women and child care, like any other healthcare, actually is becoming expensive, and cutting down the cost is a very, very, very big challenge, because with lots of new advancements in technology and lot of new missions coming in and lot of new expertise, like all the super specialty doctors coming in, obviously the cost is going up in women and child healthcare also, like any other health sector. And we are aware of it, and we are cutting down, and we are actually making sure that they are in line, and our patients get the maximum benefit at the cost which they can actually afford. We are doing that by ways like telemedicine and reaching out to different geographics, like when we are opening centers in different parts of India, so that they don't need to travel and they don't need to spend that much of money in traveling and stay and coming over to metros. So we are reaching out to them physically and also virtually, and which is helping in cost cutting to the patients.
Dr. KP, what is the unique selling point of Ankura Hospital, the USP?
The USP of Ankura Hospital is providing quality care with the right expertise by reaching to them and also by spreading across the geography. So we not only provide the quality of care and also we provide the right expertise at the right time and at the right place.
Now, Dr. KP, what are the number of specialists and healthcare professionals on board with Ankura Hospital?
When it comes to doctors, we have more than 100 full-time doctors, specialists working with us. I'm talking about the pediatricians or obstetricians and gynecologists. And when it comes to the total workforce, we are around 2,000 people working with Ankura Hospital. I'm very proud to say that we are a big family of 2,000 people.
Happy to know that. In fact, Dr. KP, how many centers and total number of beds in the state of Telangana?
In the state of Telangana, as of now, we have 700 beds, and we are expanding, and we are hoping to reach 1,000 bed mark maybe in next 18 to 24 months. And if we include both Telangana and Andhra Pradesh, we are already at 800 beds, and we are coming up with one more unit in Vijayawada, which is the 120 bedded facility. We are definitely there to reach 1,000 bed mark in next 18 months.
How many total centers do you have as of today?
As on today, we have 10 centers. The 11th one is coming up at Vijayawada next 3-4 months.
Our viewers have already seen that Shri Sonu Sood, the great humanitarian, has become a brand ambassador of Ankura Hospital. So what's the experience behind getting him on board?
As you rightly said, he's a great humanitarian. I should thank Mr. Sonu Sood for accepting to become the brand ambassador of Ankura Hospital. During the pandemic, actually, everyone knows that he has done many things to help people. One of that is healthcare needs. So many people approached him with healthcare needs, and few of those patients he has suggested Ankura Hospital because they are from Hyderabad and they were kids with special needs. So he has suggested our hospital, and they have got right kind of treatment, and those patients were also very happy, and they have given that kind of feedback to Mr. Sonasu. And he said, like, I mean, we had a meeting maybe 3-4 months back when he visited Hyderabad. Then we thought, we should continue this and we should take it to next level. What connects us with Sonu Sood is the empathy and also the commitment what he has given to the people, and the kind of support which he has offered to the people, and which are kind of the similar attributes what Ankura is also having. So then we have proposed him to be the brand ambassador of Ankura Hospital, and which he has happily agreed to do that. And yes, now he is on board, and I should thank Mr. Sonsu for that.
Good to know that. In fact, Dr. KP, any plans of expanding Ankura hospitals apart from the 2 Telugu states in the pan-India?
We do have plans of expansion to northern part of India. Maybe over next 3 to 4 years, we will be expanding to northern part of India and also to other states in south like Karnataka and Tamil Nadu as well. Yes, we do have plans.
Good to know that. In fact, last but not the least, before we finish, is Ankura Hospital looking at going public and getting listed, anything in the next 5 to 10 years?
As of now, we don't have the plans of going public, but it may happen maybe after 5 years. But as of now, we don't have those plans.
Yeah. Thank you very much, sir.
Thank you
so much for it.
Thanks for giving this opportunity.